I welcome you all. Thank you for coming to the 5th annual release of poverty benchmarks in New Jersey, which has now become something of a state fixture. LSNJ, through PRI, initiated the benchmarks series to accomplish two major goals. One is to collect all significant New Jersey-specific poverty data in one place, one book, and one place on the web, which is findable through our main website, lsnj.org, and just go to the Poverty Research Institute page. We do this to serve our mission of shining a light on the causes, extent, effects, and possible solutions to poverty in the state. And to do that by informing the public, as well as policymakers, about what's really happening. We secondly sought to do this on an annual basis, so we could benchmark it, so we could compare year to year the progress of the state, the situation with poverty, is it better, is it worse, and kind of provide some kind of guidance to us all as we try to champion the state's, our society's struggle against poverty. The program today will consist of three principal parts. One is, first, the presentation of the highlights of the data. We're not going to go into every nook and cranny of it, but the presentation will be by Shivi Prasad and Zane Kratzer, two of our senior researchers who were absolutely instrumental in pulling all of this together over the past several months. I will then give you a very brief overview of the structure of the recommendations that we made growing out of the data. And then Anjali Srivastava, who is our research director at PRI, will moderate a panel of providers and advocates concerned with poverty in the state, and we will ask them to react to the recommendations. And then finally, Anjali will offer some closing thoughts and remarks to speed you on your way. Just from my perspective, very briefly, I think there are at least three major storylines here today. One, an overall sharp increase in poverty, obviously tied to the Great Recession. Second, a harsher increase for groups traditionally more vulnerable to poverty, children, elderly, and racial and ethnic minorities. And thirdly, the emergence or evidence of newly poor, first-time poor groups, and the presenters will go into that more. A fourth storyline, which we really can't say is new this time, but rather grindingly similar, is there's no improvement in New Jersey's patterns of residential segregation. If anything, there's actually a worsening patterns of segregation residentially along economic, racial, and ethnic lines in particular. It makes those patterns make dealing with the consequences of poverty even more challenging than they would be otherwise. So let me introduce Shivi and Zane and turn it all over to them. Thank you.
Good morning, I'm Shivi Prasad. I would like to welcome all of you to the latest benchmarks report. As many of you know, Poverty Benchmarks is an ongoing project of the Poverty Research Institute. The report is published on an annual basis usually available between January and March every year. This report is the 5th in the series and is also available on our website, along with all previous 4 versions. In this presentation, I'm going to focus on a few key highlights from the report. Overall, poverty, after staying more or less stagnant for 4 years, increased from 8.7% in 2008 to 9.4% in 2009. More than 799,000 residents were below the official poverty level in 2009. This includes 57,000 residents who fell into poverty within the last 1 year. Severe poverty is a measure of extreme deprivation and represents an annual income of less than $8,700 for a family of 3 with 2 children, which is quite low to say the least. More than 350,000 New Jersey residents had incomes below this threshold in 2009. Overall, poverty at this level increased from 3.9% in 2008 to 4.1% in 2009, adding nearly 12,000 more people to the severe poverty ranks. 200% of the federal poverty level is generally considered closer in adequacy because of its proximity to the real cost of living. Here we see poverty rates for residents with incomes below 200% of poverty. In 2009, about 1.9 million residents had incomes below this threshold. Poverty at this level increased from 20.8% in 2008 to 22.5% in 2009, adding nearly 150,000 new people to this poverty bracket. This slide shows the change in population size at various income levels between 2005 and 2009. Overall, the population in the state increased by about 31,000 people. The number of people below 200% of poverty increased by more than 100,000 people. The number of people in the middle income groups decreased during this period. The number of people with incomes above 500% of poverty increased by more than 33,000 people. In effect, the lower income levels are swelling, and the middle class is shrinking. Racial and ethnic minorities form another group that is highly vulnerable to poverty. The rise in poverty in 2009 was the highest for Hispanic and Latinos. The poverty rate for this group increased from 16.5% in 2008 to 18.3% in 2009. Overall, child poverty increased substantially in 2009. It increased from 12.5% in 2008 to 13.5% in 2009. An additional 20,000 children slipped into poverty in just 1 year. Poverty rate for white children remained quite low at 6.4%. In contrast, at least 1 in 4 children belonging to racial and ethnic minority groups lived in poverty in 2009. Female-headed families with children is yet another group that is extremely vulnerable to poverty. Poverty rate for female-headed families increased from 27.8% in 2008 to 30% in 2009, which is more than 10 times that of married couple families. While single-parent families with children headed by white women experienced lower poverty in general, the rise in poverty was in fact highest for families headed by white women. The poverty rate for this group increased from 18.2% in 2008 to 21.4% in 2009. However, such families headed by racial and ethnic minorities have the highest susceptibility to poverty. At least 33% or more of these families were below poverty in 2009. The poverty rate for both Black and Hispanic and Latino female-headed families increased in 2009. Our data also shows that people with disabilities have a higher representation among the poor. In 2009, 22.5% of the total population lived below 200% of poverty. but a substantially higher proportion of people with disabilities fell below this income category. On the other hand, 77.4% of the total population was above 200% of poverty in 2009. However, only 62.1% of the total population with disabilities was in this income bracket. While poverty levels remain stagnant for elderly population at 7%, because of recession, some earlier insulated groups are facing new challenges. This chart looks at poverty among people between the ages 45 and 54 years. From 2008 to 2009, poverty for this group increased from 5.5% to 6.4%. More than 12,000 people within this age group slipped into poverty in 2009. The second chart shows poverty for people between the ages 55 and 64 years. From 2008 to 2009, poverty for this group increased from 5.4% to 6.4%, adding more than 11,000 new faces to the poverty ranks. Now, most of the data that we discussed in the previous slides depicted statewide averages, which means, obviously, that some areas are worse off. While poverty rates are much higher than the statewide average in some counties, these disparities widen when we look at poverty at the municipality level. This means greater challenges for vulnerable populations in those areas, such as women and children. Poverty becomes even more concentrated when we look at racial and ethnic minorities in smaller places. However, it is not always possible to calculate poverty rate for all groups in all areas, especially small areas. But it will be helpful to keep this at the back of your mind as we look at poverty at the county and the municipality level. This slide shows poverty at the county level. Passaic County had the highest poverty level in 2009 at 17.2%, followed by Cumberland County at 16%. These are the counties on your left, the tall bars. The red line shows the state poverty rate. This slide shows poverty at 200% of the federal poverty level at the county level. The poverty rate was again highest in Passaic County, where 34.7% of residents lived below the official poverty level in 2009, followed by Cumberland County, where 34.4% of the total population lived below 200% of poverty. Even in Hunterdon County, 11.6% of the population was below 200% of poverty in 2009. This slide shows poverty at the municipality level. Data for about 70 such places is available through the American Community Survey 3-year averages. This chart shows 12 of the 70 places with highest poverty in the state. At least 1 in 5 persons lived below the official poverty level in 11 out of 12 of these places during 2009. Poverty was highest in Camden City, where 36.7% of the total population lived below the official poverty level in 2009. This slide shows the percent of population below 200% of poverty at the municipality level. In Camden City, nearly 65% of residents were below 200% of poverty, 3 times the state average. In 8 places, more than 50% of the population lived below 200% of poverty. In the rest of the 4 places as well, population below the federal poverty level exceeded 42%. Another issue we discussed in our benchmarks report is the clustering of racial and ethnic minorities in high poverty places of the state. Overall, 61.5% of the total population in the state was white in 2009. 13.6% were Black or African American, and 16.3% were Hispanic or Latino. Now, these are the 12 places with highest poverty in the state. With the exception of Millville and Lakewood, in the rest of the places, whites are a minority. Now, these numbers are noted in red on the screen. Less than 30% of the total population was white in New Brunswick, and less than 20% were white in the rest of the places. On the other hand, majority of the residents in high poverty areas are either Black or African American or Hispanic or Latino. 86.5% of the total population in East Orange was Black or African American in 2009. In fact, the proportion of Blacks or African Americans was higher than the state average in all high poverty places except 3. However, in 2 out of these 3 places, Passaic and Union, the lower population of Blacks is made up by a significantly higher proportion of Hispanics or Latinos. The opposite is true for places with low poverty in the state. In 10 out of 12 places with lowest poverty, the proportion of whites is much higher than the statewide average of 61.5%. In many of these areas, the number of Blacks or African Americans is so small that the census is not able to provide any reliable estimates. These places are depicted by an asterisk on the screen. Except for Maplewood, where about 30% of the population was Black in 2009, the rest of the places have a much smaller proportion of Blacks compared to the state average. The proportion of Hispanic and Latinos is lower than the statewide average of 16.3% in all these places. So what does it mean to be poor, and how does it affect access to daily necessities? The Aspects of Poverty chapter in Benchmark's report looks at 5 such areas, and we will look at 3 of those. This slide shows the percent of New Jerseyans who did not have access to consistent, sufficient food for active, healthy living due to lack of resources. Food insecurity reached an all-time high in 2009. 11.5% of New Jersey households experienced food insecurity during that year, the highest since the USDA started recording data in 1995. While New Jersey continues to make improvement in providing healthcare coverage to its residents, some concerns remain. Overall, about 14.9% of the total population continued to lack access to health insurance in 2009-2010. In the below 100% income level, New Jersey continued to make progress for the 2nd consecutive year. However, a large proportion of this population, 29.8%, still lacked health insurance coverage during 2009 and 10. Overall, children's uninsurance rate continued to decline for the 2nd consecutive year from 13% in 2008 to, it's down to about 10.2% now. Access to health insurance also improved for children living in poverty. Only 18.9% children lacked health insurance coverage, according to the latest data, substantially lower than 33.4% children who lacked health insurance about 2 years ago. Nevertheless, the percent of New Jersey children living in poverty with no health insurance coverage remains higher than the US average of 15.4%. Renters who use more than 30% of their income on rent are termed as being cost-burdened because it leaves very few resources to meet the costs of other necessities. The percent of renters who were cost-burdened increased from 51.2% in 2008 to 52.6% in 2009. An additional 33,000 renters became cost-burdened in 2009. Those who use more than 50% of their income on rent are termed as being severely cost-burdened. The percent of renters who were severely cost-burdened in the state increased from 25.6% in 2008 to 27.4% in 2009. More than 27,000 additional renters became severely cost-burdened in 2009. I would like to conclude by saying, while recession is gone, lingering effects remain. If historical trends hold, the situation will stay the same, or it could even worsen before it begins to get better. We just need to remember that these are real people in real situations. Now I would like to hand over to Zain, who will discuss some of the state programs that address elements of poverty. Thank you.
Hello. Next, I would like to just go over a few program developments in a select number of statewide anti-poverty programs. Now, it's important to note with this that although we point out resource limitations of individual programs and we call on the state to do more for households with low income, we believe that these programs are crucial to the survival of many low-income New Jerseyans. Without many of these programs, the situation in the state would be much worse. So as we talk about some of these programs, and you'll hear a lot more when we do our panel discussion. Some of the panelists have expertise in a number of these areas, and they'll be able to go into more detail. But it's important for us to keep in mind that these are crucial programs that we would like to see flourish and have more impact. I'll begin with income supports, primarily the Work First New Jersey program. If we look at welfare caseloads dating back to 1970, this includes the pre-reform AFDC program and the current TANF program. We notice from historical trends that peaks in unemployment rate in the mid-70s and again in the early 90s was generally accompanied by increases in welfare caseloads. This is a pattern that we would expect to find. As a basic safety net, the welfare system is designed to provide income support for low-income workers as they attempt to transition back into work after a period of unemployment. Since 2000, however, this trend has not kept up. We see two peaks in the unemployment rate over the past two recessions, whereas the welfare caseloads remain unresponsive and actually continue a steady decline. There's very little hard evidence to suggest this particular phenomenon and why this is happening, although we can see that the program does have a limited impact as a safety net during times of economic hardship. If we take a closer look at TANF and GA caseloads since 2003, we see another interesting trend. During the recessionary period from December 2007 until June 2009, which is indicated by the shaded region on the graph, the TANF caseload decreased slightly from about 39,000 to 37,000 families. The caseload then saw a slight increase after the recessionary period. Overall, from the beginning of the recession in December 2007 up until August 2010, which is the latest period that we have data for at the time of print, the TANF caseload increased by only 3%. During the same time period, however, the GA caseload increased by a total of 38%, from around 39,000 to 54,000 recipients. During the period of the recession alone, a time which sees the TANF caseload experience a slight decline, the GA caseload experiences a 21% increase. So this data suggests that GA is a program increasingly being relied upon by the state's most vulnerable populations. Another issue to consider is that cash grant levels have not been increased since 1987. This includes no adjustments for inflation. The current TANF grant, the maximum grant is $424 a month for a family of 3. This would be a single parent with 2 children. This annualizes to just over $5,000 a year, which is a level below the severe poverty threshold. Even when we combine maximum allowable food stamp benefits for a family of 3, the combined benefit would only be about 62% of the federal poverty level. This is just above severe poverty. Between 1996 and 2010, the lack of increase in cash grant levels actually resulted in a 28% decline in the real dollar inflation-adjusted value for this benefit level for a single parent with 2 children. So, in other words, most welfare recipients are living at or near or below a level of severe poverty, which obviously is a situation that makes it very hard for many of them to work and progress towards self-sufficiency. The number of people applying for unemployment insurance remains high. Since the end of the recession, initial unemployment claims remain stable, or I should say, prior to the recession, initial unemployment claims remain stable, oscillating between about 9,500 to 11,000 on a weekly average. Since the end of the recession, initial claims have remained above the 11,000 mark in all but 2 months, April and November of 2010. So the range of average weekly claims remains higher than the pre-recession levels. Just like the GA caseload, food stamp usage has also seen a continued increase during the recession and beyond. Over the course of the recession, the number of adults enrolled in the food stamp program increased from a little over 200,000 to a little over 250,000 recipients, which is an increase of about 21%. Overall, since the beginning of the recession in December 2007 up until August 2010, adult food stamp usage has increased by over 61%. So an additional 130,000 participants are receiving food stamps. Despite these steady increases in food stamp usage, New Jersey has historically been among the lowest performing states in food stamp participation rates among eligible households. With regards to the SNAP program, which is the new name for our food stamp program, USDA's Program Access Index, which is a proportion of the number of SNAP participants to the number of people living below 125% of federal poverty, indicates continued low participation in food stamp program. New Jersey's 2009 index ranked 45th in the nation, down from 44th the previous year, and that's with 1 being the best and 50 being the worst. With regards to the school breakfast program, we see similar results. New Jersey student participation in the school breakfast program remains among the lowest in the nation. Student participation in the program in New Jersey ranked 46th in the nation, down from 44th the previous year. Access to safe and affordable housing is obviously a growing concern for many of New Jersey's households with low and moderate incomes. Shivy already presented some of the data, but I just wanted to go over a couple more notes here. This table shows the fair market rent for a 0, 1, or 2 bedroom household in New Jersey for 2010. The middle column shows the annual income that would be needed to afford this fair market rent, and the third column is the number of full-time minimum wage jobs required to meet this income. In New Jersey, a family needed 3.4 full-time minimum wage jobs in order to afford a 2-bedroom unit in 2010. This rate is up slightly from the 3.2 jobs needed in 2009. This is even more striking when we consider that many low-income families are led by single parents, so obviously there's not too many low-income households that can afford to even work 3.4 full-time jobs. Additionally, in 2009, there were over 500,000 renter households that were cost-burdened, and another 250,000 households that were severely cost-burdened. In the past, New Jersey may have looked to and relied upon federal programs to help meet housing needs. However, due to funding limitations at the federal level, it has been reported that only 1 in 4 households that are eligible to receive federal housing vouchers actually receive any form of federal housing assistance. So, with this decreased support from federal housing programs, a greater burden has been placed upon the state to respond to growing housing needs. In New Jersey, there are 2 key state housing programs that we cover in the report. One being the State Rental Assistance Program, which is a supplement to the Federal Housing Choice Voucher Program, otherwise known as Section 8, and the other one being the New Jersey Affordable Housing Trust Fund. The State Rental Assistance Program, also known as SRAP, is currently providing housing for a little over 4,300 people. The DCA waiting list, however, for SRAP, it totals over 3,600 statewide, and these waiting lists were closed as of December 2008. So although continued funding for the state for SRAP remains, the need for rental assistance outgrows program resources. Some recent analysis suggests that increased appropriations will be required in the upcoming fiscal year in order for SRAP to continue to match its current number of vouchers. As for the Housing Trust Fund, as part of the balancing efforts of the fiscal year 2011 budget, unspent trust fund balances were recaptured into the General States Fund, and appropriations for the program were limited from the full amount required. As a result, there's currently no available funding in the trust fund to build or rehabilitate new affordable homes, or for the trust fund to assist the nonprofit sector in developing new affordable housing. If we look at healthcare, Shivi showed you some of the data on the uninsurance rates, and although an increase in the percent of New Jersey residents with health insurance coverage shows a positive trend, there's certainly still some issues that remain with regard to healthcare access. In March of last year, New Jersey family care eligibility for parents and caretakers filing for new applications was reduced from 200% to 133% of the federal poverty level. A recent analysis indicates a total impact of over 47,000 parents or caretakers that will be either terminated or denied from family care in the current fiscal year as a result of this policy change. Equally concerning was a 2009 national survey of trends in Medicaid physician reimbursement rates between 2003 and 2008, which found that New Jersey's physician reimbursement rates were the lowest in the country. Because rates are so low, very few physicians accept patients with Medicaid. So while technically many New Jersey residents have health care coverage, still many have limited access to quality health care. I'm just going to go over a few other program developments. There are some SSI recipients that will see decreased payments this year. SSI is the Supplemental Security Income. It's a monthly stipend for aged, blind, or disabled persons that meet the financial need criteria. And SSI recipients, the individuals that were living with an ineligible spouse, received the optional state supplement, which will be reduced as of January 1st this year, causing hardship for many clients in that category. The minimum wage in New Jersey remains stagnant. As of January 1st of this year, 7 states increased their minimum wage. And New Jersey, despite its high cost of living, remains one of 24 states to merely match the federal minimum wage of $7.25 an hour. There are currently 17 states plus the District of Columbia that have increased their minimum wage above the federal level, and 9 states that are at or above $8 an hour. Just for comparison. State taxpayers will also see a decrease in the earned income tax credit this year. The state EITC reduced its credit to 20%, down from the 25% of the federal credit as of January 1st of this year. As a result, a single parent with 2 children working a minimum wage job could lose up to $300, which could be equal to about a week of pay for a low-income worker. And last but not least, I'm sure we might discuss this later with our panel discussions, but with regards to affordable housing legislation in New Jersey, there's still much uncertainty that lies ahead. While the state currently debates the new housing legislation, the COA process, which is in charge of defining fair share municipal housing obligations, that process has continued to stall for about a decade. And the courts may now ultimately have to decide the fate of New Jersey's future affordable housing policy. And with that, I would like to turn it back over to Dee Miller. Thank you very much.
Great job, and thank you, Shivi and Zane, very much. I'm not sure where there she is. I just want to take 1 second to introduce a critical member of our PRI staff who just recently has left to relocate to another part of the country, Sabina Schoenbach, up here in the front row, who did remarkable work, in my judgment, on the analysis of the programs and in helping shape recommendations in this report, which each year we strive to do a little bit better to get a comprehensive and holistic view of the approaches of state government to poverty. Each year I think we get a little bit closer to it and better, but I think under Sabina's work this year we actually took a huge step forward in that regard. So thank you, and miss you. Just to locate what I'm going to touch on very briefly before the panel in the book, I'm going to first talk about what I call the framework section in terms of thinking about improvement of governmental response. That you will find at pages 96 and 97 of the book. And maybe the underlying motto of that section is, it's about the poverty. It's not just about the symptoms or the needs, housing, education, healthcare, the individual components. It's about poverty as a whole. People in poverty suffer and have all of these needs, and typically need assistance across the entire spectrum of needs. So what we tried to do, we introduced this actually in one of the fall reports that's out there, and we've now kept it as a continuing theme, is step back and think about more comprehensively what state government needs to do, not just build a better housing policy or build a better this kind of policy, but as a whole, what does it need to do if it's going to have a meaningful impact on poverty writ large. And we think that the 10 recommendations at pages 96 to 97 capture a lot of what the state will need to do, truly or the federal government for that matter. It's government at any level in trying to fashion a comprehensive anti-poverty response. One of the things we believe they need to do is pull poverty programs ultimately under the umbrella of a single state entity, maybe an agency, maybe some kind of super entity. We make a couple suggestions about how that might look. Secondly, we really need to update every year consistently, much more frequently than every year, a comprehensive map of state programs and voluntary programs that are designed to assist people in poverty, and all of the people working in every one of those programs, legal services, food programs, housing programs, education programs, schools, needs to have access to that map. It obviously ought to be web-based, very user-friendly, person-friendly for people in poverty, but also user-friendly in terms of the faithful who are working in these agencies. The big sort of catchphrase here I would offer is fight siloization, fight silos, break down the compartmentalization of anti-poverty programs so that they really can work in a harmonious and coordinated and comprehensive way. Thirdly, design programs that are cognizant of and really incorporate awareness of the tipping points and factors that cause the collapse of an individual or a household's economic situation and the fall into poverty, and design effective remedies to those collapse and tipping points. And just a few other highlights. I'm not going to go through every one of these, but reject stereotypes about people in poverty. Our experience, the experience invariably of people who work on behalf of people in poverty every day and every year, is that people in poverty don't want to be poor. They want to help themselves. Most of them are trying very hard to, as Zane was suggesting, hold down 1 and 2 and even 3 jobs. 3.4 is a little steep. Reject stereotypes, and most importantly, reject rulemaking and programs built on stereotypes that people have to be, the poor have to be regulated, they have to be stimulated, they have to be punished if they don't work, et cetera, et cetera. And the last thing I'll highlight before just moving on and introducing the panel, design the anti-poverty programs in a way so that they are cognizant of and aimed at the real cost of living. 200% of poverty. Well, L&J, PRI will issue another real cost of living study this fall, this coming fall. I have no doubt that being, I think, the 6th or 5th in the series of those, that the message is going to be the same, that the federal poverty level is essentially irrelevant except as a marker of extreme poverty, severe poverty and extreme poverty. True poverty in New Jersey is somewhere probably around 200 to 250% of the federal poverty line. Depends on the county in the particular area. And you got to design employment policies and that sort of thing that are conscious of that and take that into account and are designed to achieve an income at that level. Just to sort of break down the rest of the report for you so you can sort of follow along as the panel talks, essentially pages 99 through 128 of the report are an examination of state programs in 5 major areas of responses to poverty. They are the areas of income support, employment, food and nutrition, housing, and health care access. And that's obviously much more than is suitable for a presentation of this type this morning, but I commend them to you. That analysis is one of the things that the panelists this morning will be reacting to. And then following that on pages 129 to 136 are the actual sort of hardcore recommendations that we're making. They fall sort out into 4 major areas. Supports that are necessary to make work accessible, to make work feasible for people in poverty. Cash grants can't stay at 1987 levels because that doesn't present any kind of stable household foundation for people to be able to work. UI needs some correction and reforms in the hearing process and the hearing determination process. Also, the introduction recently last year of a new standard for gross misconduct is itself gross misconduct and needs to be reformed in a hurry. There's legislative proposals out there to do it. And the family leave insurance program that was a wonderful program conceived and introduced a couple of years ago is vastly underutilized, and that underutilization needs to be addressed. Secondly, we need, as a society and as a government, to ensure that those who work and work full-time can be economically stable. The expression is often used self-sufficient. That may be a little extreme, but at least financially stable, not financially insecure. That means wages that do meet the real cost of living, and the enforcement of wage laws, which are for the lowest income people, especially immigrants, often scoffed at by many employers in this state. And that you really need web and a strategy for enforcement. Third, we need to, for sure, ensure adequate support for those who cannot work by reason of disability or other factors. And that gets back in part to the programs for assistance, financial assistance to people with disabilities. Also gets back to grant levels in the welfare programs. And lastly, we have to ensure while we're designing these longer-term comprehensive programs that we're taking care of what we call the stabilizing factors: food, healthcare, housing, those needs, which tend to be very immediate and very destabilizing if they're not met, have to be accounted for. So I'm going to introduce Anjali in 1 second, and she will bring up the panel members, and just offer one caveat and one, I guess, exhortation. The caveat is this report and today's presentation is not at all directed at, nor does it constitute an analysis of the current state budget or the proposed state budget. And LS&J and PRI today in this document are not making direct comments on that. It's really just beyond the scope of what we can do in this report. We leave that process of analysis and comment for other subsequent forums, particularly those that are going to be conducted under the auspices of the Anti-Poverty Network. That said, in commenting, some of the panelists today certainly are going to present their own observations, either from an individual or perhaps an organizational perspective. They'll make that clear when they do that. I'm going to have to leave you in the very capable hands of Anjali. I've got to go back, actually, and LS&J is preparing an emergency response to this statewide foreclosure reform proceeding that's going on judicially as we speak, and we've got to get a filing in tomorrow on that, so I've got to pay attention to that. I would say, just from the perspective of a person who's worked fighting poverty in one small way for more than 40 years in this state, that folks are still very much, I'm tempted to say more than ever, but it's more than recently. More than ever is a little bit of an extreme statement. Very much in extreme need in this state. And unfortunately, too many in this state go about their daily lives not thinking of folks in poverty, not thinking of their conditions, and most importantly, not doing anything about it. Our job collectively, and all of our colleagues that we associate with, is to, at the very least, continue to do everything in our power to call attention to those conditions and to demand of ourselves, of our society, and ultimately of our government that it respond in a meaningful way. Thanks very much, and enjoy the rest of the program.